And then finally, on Mondays, Wednesdays, and Fridays, there's something called a public option in the health insurance, in the health care reform bills. And sometimes it's an opt-in, sometimes it's an opt-out, sometimes it has a trigger, sometimes it's robust, sometimes it's not so robust. But essentially it all boils down to the idea that the government's going to create a health insurance plan which is going to compete with private insurance with the idea of keeping insurance companies honest. Well, that might be good if there was actually going to be some sort of fair competition that takes place. But the problem is that a public option is ultimately subsidized by the taxpayers. And therefore, it can always offer more benefits at a lower cost than private insurance because it doesn't matter how much money it loses. If it loses a couple of $100 billion this year, so what? The taxpayers will just make up the difference. Now, I recognize that in theory, they say the plan's supposed to be self-supporting. It's supposed to support itself completely out of its premiums. It's not supposed to receive any government subsidies. Well, so were Freddie and Fannie. I mean, what are they going to do? Let's assume they have the public option and it underprices its premiums and it starts losing hundreds of billions of dollars. They're just going to say, oh well, we tried it. I guess we'll have to go out of business now. Or do you think a Congress which is busy bailing out banks and auto companies and anyone else that seems to be around these days with a tin cup might actually bail out the new public option? And as long as it has either an implicit or an explicit guarantee from the taxpayers, it will always be cheaper than private insurance. And if that's the case, what's going to happen to employers? They're going to look at this and they're going to say, I'm not stupid. Here's the price for the public option. Here's the price for the insurance I'm paying today. Guess what I'm doing to my workers? They're all going in that public option. And they're going to be dumped. Not through choice, not because of competition, not because it's more efficient, just because the taxpayers are keeping it cheaper, and they're going to dump, we think, somewhere in excess of 89 million workers into this public option. So people are not going to be able to keep the insurance they have. Second question, how much is all this going to cost? The short answer is a lot. The House bill, according to the Congressional Budget Office, costs about $1.1 trillion over the next 10 years. Now, the Senate version, I have to say, is cheaper. They labored mightily, and so far the Senate Finance Committee bill came in at about $835 billion, for which they congratulated themselves. Do you remember when $835 billion was actually a lot of money? Nowadays it's a rounding error in the latest bailout. But at any rate, that's what they're saying. Now, in order to get those two numbers, they did play a little fast and loose. For example, under Medicare right now, Medicare is scheduled to have a 21% across-the-board cut next year. That's under current law. They've been scheduled to have that 21% cut since 2001. But they've never actually made it. Because Congress, not being stupid, knowing that if you cut Medicare by 21%, they'll be beaten to death by people with canes and walkers, postpones that every year. Well, these bills simply assumed that it would take place. They then introduced separate legislation to pay the $250 billion to fix that problem and to not have those cuts, and said, but that's a separate bill. That doesn't count against the cost of the health care reform bill. That's over here, it's a whole separate bill. Just think of that for your own budgeting. Your budget's much better if you don't have to make your auto payment. You can do that as a whole separate budget, right? Looks better. So they both did that. They both take about $250 billion and they put it off budget for these separate bills. But even more than that, there's a little bit misleading in there. And I just want to do this one chart to show you what's going on. Let's assume, here's your chart. This is cost. The Congressional Budget Office by law, looks at a 10-year budget window. What that means is they start next year, 2010, and they can go out 10 years, 2019. So when they say the House bill, for example, costs $1.1 trillion, they're talking about from 2010 to 2019, it'll cost $1.1 trillion. The bill doesn't take effect until 2014. See a problem? And in fact, when it starts very slowly. The first year it only costs $6 billion. Then it starts like that. And we stop here in 2019, and that's the $1.1 trillion. But look at this trajectory by the time you get to 2019. In fact, if you wanted to take the bill, let's start here in 2014 and go to say 2024, so we're looking at 10 years when there's actually a program. It doesn't cost $1.1 trillion, it costs $2.5 trillion. So we're talking about a lot of new spending. We're also talking, a lot of new taxes to pay for it. In the $1.1 trillion number, there's $700 billion in new taxes to pay for it. And we're talking about a lot of debt, which means new taxes for you. Not for me necessarily, but for you. Because they're assuming all sorts of future cuts in this. $500 billion in future Medicare cuts. Now, do we really think they're going to make $500 billion in future Medicare cuts? This is a Congress that right now is giving seniors $250 simply because they want to make seniors happy before the elections. They didn't get a cost of living increase this year because there wasn't any cost of living increase in their Social Security. So the administration's mailing them all a $250 check just to be nice. Not financed, of course. That's just future debt. And they're also eliminating their premium increase that's supposed to go into effect this year for their Medicare premiums are supposed to go up. They're just eliminating that for next year as well while they're at it. So do we really think they're going to follow through with $500 billion in Medicare cuts? If they don't have enough taxes to pay for it, then it's just going to mean more debt for you guys.